Hello, good morning. I am Dr. Sanjay Deo, Consultant Orthopaedic Surgeon at Symbiosis University Hospital and Research Center, Pune. Today, friends, I would like to talk regarding the robotic joint replacement, which is galvanized more attention in the last few years. It has become more of a marketing gimmick, as I would call it, and the primary complex joint replacement in patients with multiple joint deformities would benefit with a robotic joint replacement, but they constitute not more than 10 to 12% of the general population which present to us. And even in these cases, the joint replacement patients, they present so late that even in those, the joint replacement with robotics becomes a real challenge. The revision cases of joint replacements, which would require in real sense the robotic knee replacement or robotic hip replacement. The robotic surgery requires basically preoperatively CT scan to get the complete idea and for the mapping and planning for the replacement. And this incurs the additional cost. The hip surgery, which presents late and with implants in the hip joint, requires a high level of planning, and these cases would benefit with joint replacement and a robotic scenario. The robotic implants or inputs are important in only maximum 10 to 12% of the patients, where the balancing of the soft tissues surrounding the joint requires the finer adjustment, and it is not possible in these cases with conventional methods. The imageless robotic knee replacement or hip replacement as such, which is there only right now with the knee replacement and not in the hip replacement. So there is a limitation even in that also. The proper robotic surgery even today has some limitations in our country, as these patients present quite late, and so the robotic correction is beyond its limitation to solve that issue. So I would consider robotic knee replacement only in not more than 10 to 15% of the cases as a primary replacement. I am using this particular word with caution that I am talking mainly about the primary or index surgery. I am not considering the revision surgeries here. So I would consider, and I would tell the general public in particular, that joint replacement in majority of the cases do not need a robotic knee replacement in the first place. Thank you.